Here's how to use a pulsating massage gun on your back. Where you should focus, where you shouldn't put it, when you shouldn't be using it at all, and some great tips. Here we go. These massage guns are great if your back is stiff or tight, but if it's painful, particularly sharp or jabbing, don't use it because you'll only increase the inflammation in your back. Here's a good test for inflammation. If your back hurts to extend or hurts on side bending on the same side you're leaning to, that indicates inflammation, in which case you should be icing your back, not massaging it. To be sure, ask a healthcare professional. For the mid-back, lumbars and glutes, use the trusty old foam ball. For the sacrum and the pelvis, use a softer tip, the hollow head though, because on bony surfaces, the foam ball can bounce a little bit, particularly on skinny people. You can use the massager on your own back, but it's actually better to lay down and relax the muscles and have someone else use it on you. Don't use a massager over the spinous processes of the vertebra, the hips right out to the side, or on the sides of the low back where the kidneys and other organs are. With the foam ball, start off focusing on the main band of muscles running up either side of the spine. Take particular care in the lowest part though. If it's tender, it could be inflamed, so avoid that spot. Some people find the massager uncomfortable over the thoracic muscles, especially if they've got a scoliosis or a prominent mid-back, so only use it on the thoracics if it's comfortable. Tightness in the glute max and medius contributes to a lot of back issues, so that's the next area you can work on, especially in the top half of the pelvis. If you want to try to mobilise restricted lumbar vertebra, concentrate just to the side of the spinous processes. But if you're pretty bony like me, you might need to put the foam ball on the side so it doesn't jackhammer up and down. To mobilise the sacroiliac joints, make sure you switch to the hollow head. Work in a line just inside of the two bony lumps of the pelvis to mobilise the sacroiliac joints. Don't press too hard, just the weight of the machine is usually enough. If your lower back is pretty jammed and restricted, you can try a position chiropractors use to release joints. On your side, bring your top leg forward to get the joints to tension, and then use the hollow head over the lumbar and sacroiliac joints in the last two positions that I mentioned for 30 seconds. Don't overdo this as the vertebrae are quite exposed in this position, and don't do it if it feels sensitive or it hurts. The first time you use a pulsating massager in the back, only use it for 30 seconds to 1 minute on each side, just in case it's more inflamed than you think. The next day you can increase it to 2 to 5 minutes if you want. When purchasing, make sure you find a gun that's less than 42 to 45 decibels because they can get a bit loud, and try to get one with a long handle so you can reach around and do your own back. For those of you with chronic low back issues or problems in your glutes, I have a video on low back pain relief exercises and another video on how to release your glutes. So I'll put those links in below. But hope you liked the video. If you did, give it a thumbs up, consider subscribing and write a little comment, and I'll catch you next time. Have fun. These massage pistols. But if you've got sharp pain, particularly sharp pain,